gloves on. I'm gonna go ahead and just rub your hair real quick and just do that. Now, does that feel good?
Yes.
Okay. Can you please state your main name, please?
Abigail Pettiton.
Can you please state what time it is right now?
3 p.m.
Do you know where you are?
at the hospital in Chippenham.
Now, do you know who the President of the United States is?
Donald Trump.
Oh, okay. The patient is orientated times 4. She is orientated with time, place, person, and situation. And I assessed her head, and she has no bruising, no lesions, no sutures, no bumps, no redness. She has hair all over her scalp, and she has no lice. Um, none of that is noted and on her head. Now, I'm going to go ahead and, if you can face me, I'm going to do a facial symmetry on you. Okay. The patient has symmetry on eyes, nose, lips, and ears. Now, I'm going to go ahead and palpate around your forehead and under your eyes. And I'm going to palpate your temporals. Her pulse is strong. And I'm palpating for sinuses. Now, I'm going to go ahead and check her nose. She has boogers, and she has hair, and she has no bleeding, no different colors in there. And if she had an NG tube, I will check the measurement. I'll check the last time it was placed. I will check if I'm gonna check around the skin. I will check around. I will check if it's infected. Now, she has both in which side of if the NG tube is placed in the left or right on her nose, and she has 2 nares and. Let's put it in my nose. Now I'm gonna assess her lips. She has 2 bottom and top lip, and she has no signs of cheilitis, which is inflammation of the lips. Now I'm going to assess her mouth. Now, have you had any sore throat?
No.
Can you chew?
Yes.
Have you had any surgery done in your teeth?
No.
Do you wear dentures?
No.
Okay, patient has stated no sore throat. Patient stated she wears no dentures, that she has had no surgery in her mouth. She has 32 teeth. She has, do you have any pain?
No.
She stated she has no pain in her mouth. She has no cavities. She has no plaque. She has no bleeding in her mouth. She has no bad gums on her teeth. And yeah, that's fine. Now I'm going to assess her ears. I'm going to, do you wear any hearing aids?
No.
Can you hear on both of your ears?
Yes.
Patient states, I see earwax on her ears. Patient states no pain in her ears. Patient wears no hearing aids, and I see no bruising, no sutures, no lesions on her ears. Now, I'm going to go ahead and assess her throat. Can you swallow for me? Okay. Patient can swallow. I see no. I'm going to assess her carotid arteries, and I'll do it I'll do it once at a time, and I will not do it twice, or if not, I'm going to kill her. Her jugular veins are not distended. It's flat. And if she had a tracheostomy, I will check if there's any drainage. I will check if it needs to get cleaned. I will check if how much oxygen she's using. I will check if she's on a ventilator, and if she needs a new 4x4, which is already cut, because if not, she can die. Because they have tested that it can go through her tube. She has no bruising, no sutures on her throat, on her neck. Now, I'm gonna go ahead and assess her arm, and I'm gonna check her brachial pulse. Her pulse is strong. I'm gonna check her carotid pulse with my fingers, not my thumb. Her radial pulse is strong. She has 2 arms. I'm assessing for any bruising, sutures, lesions, scars, any inflammation, any edema on putting 1+ or 15 seconds, depending on which +1, +2, +3, +4. And she has none. I am checking if she has any IVs. If she did it, check if it was swollen or when was it last placed. I will check for, I will check her hand. She has all 10 fingers. And I will check for clubbing. She has no clubbing. She has, I will check her capillary refill, and if she had her nails painted, I will take it off. But if she had gel, I would not be able to take that off. So I will check the tip for capillary refill, 3 seconds for adults and 5 seconds for elderlies. And and it came back in 3 seconds. Now, what else? I'm checking for cyanosis. No cyanosis stated. And I would ask her to squeeze my fingers. I would ask her to pull on my fingers, to push and pull. And she's able to pull, squeeze, and pull, squeeze, and push on with her hands. Now I will ask her to push on her, shrug her shoulders. She's able to shrug her shoulders. Now I'm going to assess her chest. I will, for only testing purposes, I'm not going to ask her to remove her shirt, but if she was a patient, I will ask her to remove her shirt and check for any bruising, sutures, lesions, scars, if she had a chest tube, if she had any bumps. That's, of course, the boob area is supposed to be a breast, but no bumps noted. And she looks like do you have trouble breathing, ma'am?
No.
Patient states no trouble breathing. Do you have, okay, you don't have trouble breathing, you